Hi, good morning sa inyong lahat. Medyo maulan ngayon, but I just want to share yung talk na pinuntahan namin kahapon kung saan isa po ako sa mga naging speaker. Just would like to congratulate yung Philippine Society of Breast Surgeons. So, ngayon po, nagpo-form na sila ng group na composed ng iba't ibang, of course, breast surgeons from different parts of our country. And ang goal po nila is to optimize the breast care, especially when it comes to breast cancer. As we all know, it was reported in their event that breast cancer is still the #1 cancer in the Philippines. So pag-uusapan po natin kung paano makakatulong ang genomic medicine, kung paano i-approach ang management ng early stage breast cancer. Hello, we're here at Shangri-La. So I will be giving a lecture to breast surgeons. This year there will be forming Philippine Society of Breast Surgeons, and they invited us over to give some talk on a genomic, on how to approach breast cancer with genomics.
As owner, that's going to be.
So in fact, what we know now is that 25% of cancer patients who will experience distant metastasis, 75% of the patients are treated with chemotherapy. Hello po.
Hello. Hi. Mabuhay.
So good morning again. This is Dr. Rainier Mozo. I'm an internal medicine specialist and also will be graduating with my genomic medicine course sa United Kingdom next week. So yesterday I shared to the surgeons there how genomic medicine can help in our decision treatment in early stage breast cancer. Sa totoo lang po, one thing we know is that early stage breast cancer, maganda po yung prognosis. When we say prognosis, maganda po yung magiging pwedeng maging outcome. Not all patients actually require chemotherapy, and we know that while chemo decreases the chances of distant recurrences, the side effect and the damage can sometimes outweigh the benefit and significantly affects quality of life ng patients natin. So, in fact, what we know now is 25% of cancer patients who will experience yung pagkalat ng cancer, 75% po are treated with chemotherapy. So still that's a significant overtreatment. So ngayon, most guidelines, pag sinabi po natin guidelines, ito po yung mga sinusunod na doktor when it comes to rules and recommendations kung paano iti-treat, kung paano i-approach. So most guidelines right now question whether chemo can be withheld sa some patient, and according to them, this decision can be done if we will be able to know the absolute distant or the absolute risk of recurrence or pagbalik ng cancer after maoperahan at maoperahan and mag-undergo ng chemotherapy. So along of course sa pag-consider dun sa age ng patient and even dun sa comorbidities niya. So here in the Philippines, we are offering what we call the breast signature assay, which is Prosigna. So, after maoperahan po ng patient, tatanggalin ng bukol, the usual practice is to give chemotherapy sa patient. And ang sabi nila, or most of the literature is sharing that this will help in approaching dun sa mga tinatawag na micrometastasis or yung mga maliliit na pagkalat nung cancer. Pero according nga po sa guidelines, if malalaman natin yung absolute risk of recurrence is less than 10%, pwede po nating wag nang ibigyan ng chemotherapy. So genomic medicine helps in knowing a set of genes, and then specifically 50 genes po ito na related sa pagiging aggressive ng tumor, or meaning the tendency of the tumor to go back or bumalik after maoperahan. So, yun po, no? So, after mo operahan, what we usually do, we coordinate with the surgeons and we get a sample of the tumor, and after that, we will be able to know, number one, the intrinsic subtype of the tumor. Intrinsic subtypes means, dati po kasi yung breast cancer by morphology lang, by itsura ng cells, yung pag-iiba-iba or pag-classify ng breast cancer. But right now, we are in the genomic medicine era, wherein we always look or consider the molecular profile or yung pinaka molecular, dun tayo sa molecular level nung pag-identify or pag-classify ng mga breast cancer. So, napatunayan natin na we have two intrinsic subtype, which is na luminal A, and luminal B. So, ano yung importance ng luminal A and luminal B? Pag sinabing luminal A, ito yung klase ng breast cancer na hindi masyadong nagre-respond sa chemotherapy or hindi nangangailangan ng chemotherapy. While luminal B, according to studies, ito yung may mga hindi magandang pwede maging outcome. Sila yung mas aggressive. So, sila yung mas nangangailangan and in additional doon, hindi lang nangangailangan, sila yung mas responsive sa chemotherapy. So, yun yung importance. That's the number one na pinoprovide ng Prosigna. Number two, it can tell us kung within 10 years, ano yung chances of recurrence ng breast cancer after maoperahan. So, kapag ang absolute risk of recurrence is less than 10%, so that's the time we can recommend our patient to not undergo chemotherapy. So, yun po yung clinical utility or yung paggamit ng test na tinatawag na Prosigna. So, ang Prosigna, pwede po siya sa mga pasyente na postmenopausal at may early stage breast cancer na may lymph nodes na hanggang 3 lang. So, lymph node means kulani in Tagalog, hanggang pangatlo lang. Kasi pag 4 po, it means kailangan na po mag-chemotherapy. So, yan po ang natutunan natin for today. Napatunayan natin or napakita natin na ang Prosigna, which is genomic-based na technology, can be used sa medicine, specifically sa breast cancer patients, para malaman yung risk of recurrence or yung posibilidad ng pagbalik ng cancer after maoperahan. Pangalawa, kapag nalaman natin ito ay makakatulong sa mga doktor para malaman kung kailangan bang bigyan ng chemotherapy pa ang pasyente or hindi. So, again, I would like to congratulate the Philippine Society of Breast Surgeons sa pagtatatag ng bago nilang organisasyon para ma-optimize ang pag-aalaga ng mga pasyente na may breast cancer sa buong Pilipinas. So mabuhay po kayo, Philippine Society of Breast Surgeons, and hopefully sa mga viewers po natin may natutunan po kayo today, and I will be thinking of more topics pa para mas marami po tayong matutunan at na matutunan about genomic medicine. Yun lang po, mag-ingat po tayo.